Something, if you notice, we are one of the few countries where we have put a lot of measures in place. Our measures are very unique. One, anybody coming into this country have a 72-hour negative PCR test. So if you don't have a 72-hour negative PCR test, or if you are positive, you will not be allowed even onto the flight. And two, all passengers who arrive in this country are subjected to an immunofluorescent antigen testing at the airport, which we give the results out, and those who are found positive are then mandatory isolated for 7 days. So if you look at this, we have two ways of sieving. At least we are limiting the importation of the virus into the country. I will not sit here and say that we are eliminating it. We are limiting it. So these are the two ways that we are limiting it. We are now adding a third dimension to it. And that is, we are now asking that anybody who is coming into this country should be fully vaccinated. So that if you are fully vaccinated, you know what the vaccines do. The vaccines first, even if you have the virus, you will not be so sick to require maybe admission into our few intensive care beds that we have in the country. And also most of the people who, even in country, the people who have had vaccines, who are vaccinated, and those who are not vaccinated, for the past few months when the study was done at our East Infectious Disease Center, we realized about 98% of those who were admitted there are unvaccinated. And those who died, out of a number, only about 2-3% of them are people who have had some vaccination, but they all have some underlying, very severe underlying illnesses.
Okay.
So the reason we are adding the vaccination is that we want to, because we don't have a lot of people in the country who have already been vaccinated,